31 million Americans each year suffer from sinusitis, an infection caused by blocked sinuses that results in debilitating facial pain, pressure, and headache. But new medical technology is offering hope to patients in pain.
When I get a sinus attack, it starts at 2 or 3 o'clock in the morning, and this right side of my face feels like it's going to explode. It's so excruciating.
Drug therapy is the usual remedy.
The most common treatment for sinusitis is medications, and this includes antibiotics and steroids. With repeated use, they have significant health risks and do not adequately solve the problem for the patient.
Now there's a gentle treatment performed in a doctor's office that opens the sinus without surgery or repeated use of drugs.
The Vento System is a tiny device about the size of a grain of rice. It's inserted in the sinus passage. There, using osmosis, it absorbs fluid from the sinuses, gently expanding and opening the sinus passage. After about an hour, it is removed, and the patient can leave the office immediately.
In Orlando, clinical data presented at the annual meeting of the American Rhinologic Society shows that 93% of patients that underwent the Vent-Os procedure still had open sinuses at 1 year. Andrea chose to give the procedure a try.
I just had the device inserted into my sinus, and I'm in the waiting room while I wait for it to expand. And it actually just feels a little weird, a little bit of pressure. It's not painful. And the procedure, as well as the expansion process, is a lot easier than I thought it would be.
And what about the outcome?
Now that I've had the procedure, I'm looking forward to not having frequent sinus attacks where I'm stuck on the sofa for 24 hours and my friends are out doing something fun.
For more information on the Vent-Os procedure, please visit sinustreatmentinfo.com.
Sinusitis is most commonly caused by an upper respiratory tract infection such as a cold or flu. However, other conditions such as allergy, asthma, or even smoking can contribute to an environment that encourages these infections. In the U.S., sinusitis affects roughly 12% of the population, which is about 31 million people, probably more common than most people think. In addition, it makes it more common than heart disease or asthma. Sinusitis can truly be debilitating. It's been shown to impact quality of life more substantially than congestive heart failure or back pain. Clinical studies have shown that the Vent-Os procedure results in open sinus passageways in the vast majority of patients, even a year out. And in my own practice, my patients have told me that the procedure was easy, simple, and comfortable and resulted in real improvement in their symptoms and quality of life.
I've had to miss work because of it. I've been on vacations and ruined vacations because I couldn't go skiing with my friends, go kayaking. It's just a miserable experience. My head wants to explode. When I get one of my horrible sinus attacks, I've tried every painkiller I can. I've stuck my head in a bucket of ice water hoping it helps. I've even gone to the local playground and hung upside down the monkey bars, thinking that it would drain my sinuses, but absolutely nothing works. So far, the procedure has been better than I thought. I've experienced a little pressure, but no pain, and it's actually easier than going to the dentist.
But probably you're going to kind of be leaning back with your head up a little bit during the procedure. The first thing I'm going to do is just kind of put the little cotton balls in. And so Jocasta, I think to start with, we'll have you kind of stand over. So ready? Great. So now we're just going to let you sit for an hour.
Okay.
Okay,
Okay, so your problem exists right here in the maxillary sinus, and so that sinus cavity is right in here, so we're going to treat to expand that opening and be able to treat you. And the way